teachers. This is a tour of a virtual T-level health simulation suite. My name's Nicola Cook. I'm from Simmons Skills and I'm going to be your host for this afternoon's webinar. In a moment, I'm going to introduce you to Mark, who you can see on screen, who is also going to be taking us through the tour. Just before we get started, just a few housekeeping things. Your microphone should automatically be on mute, but if you could keep them on mute, that would be fantastic. The webinar is going to be recorded. So it will get sent to your inbox tomorrow. You can watch it back. You can share it with colleagues. It'll be there for you to access whenever you need to. There is a chat function with our webinar this afternoon. So down to the bottom right-hand side of the screen, you can put your messages down there. You can say hi to each other, let everybody know where you're from. But you can also ask us questions. So if anything crops up during the course of the webinar, you think you just want a bit more information about that, you can type in your message. And then you'll notice there's a ask a question button, which is a little speech bubble with a question mark in it, and then press send. And that just highlights to us that that's a question that you want to ask for us to do in the Q&A at the end. So just before we get started, just a little bit of information about us. So we're Simmons Skills, and we are a company that specialises in medical simulators and clinical skills trainers. We work with NHS trusts, universities and organisations all across the country. And as a team, we're all either teachers or former teachers, or we are people who've worked in the clinical areas. So I'm a teacher, Mark, who's going to introduce himself in a moment, worked for the ambulance service for many years. And the T-level health course is something that we've really wanted to support, coming from both clinical and an education background ourselves. I know as a teacher that it's great to finally get a budget for something, and then you're just pulling your hair out because you haven't got time to sift through lots and lots of catalogues and websites looking for everything that you need. So we devised the webinar as a way to highlight some of the key products that we think you're going to need to either get started with your health care simulation suite, or if you already have one, where you can start to develop different areas. We know there's a huge amount of choice out there, and the resource list is pretty vast. So hopefully this webinar will give you a few clues, a few ideas of where you can get started. So just before we start with the tour, we're going to ask you a very, very quick question. It's not a difficult one. It's not going to be like the horrid exams your poor students had to do in the summer. I'm just going to share this question with everybody. So we just want you to let us know how long you've been teaching T-level health for. So you could be in your first year, perhaps, maybe you have just started the second year of teaching the course, or perhaps you've not started the course yet and you're looking for some information for September next year. If you could just pop your answer in there, give everybody a moment to vote, and then we will we'll share it for everybody to see. Right, so I'm going to end the voting and share the results with everybody. So a bit of a split there. So we've got some people who haven't started teaching at all yet. That's great, because that's what we're here for. And then some of you are on your first year and second year of the course. So that's great. So we've got a good spread of people. Oh, and in 2024, we've got some people looking to start as well. So that I like that. That's super organised. You're looking way ahead. That's brilliant. Right. So I'm just going to close this and go back to sharing our screen. So I'm going to allow Mark to introduce himself to everybody, and then we're going to get started with the tour.
Good afternoon, everyone. My name is Mark. I am the Managing Director of Simmons Skills. I wasn't supposed to be here today. I've been subbed in at the last second because unfortunately Marie, our sales consultant, is not very well. So we're sending our best wishes to her. We're not quite in setting up a GoFundMe yet, but she wasn't well enough to be here today. So please bear with me. I know what I'm talking about most of the time, but we'll see if I know what I'm talking about when it comes to this. So we're going to first move on to our virtual simulation suite. Was kind of the concept we came up with to help you understand what, where everything fits and what it could look like. This isn't necessarily what yours should look like in reality. It's just a way to visualize it for you. So Nicola's going to just explain the different areas.
So from experience that we've had visiting some colleges that are setting up T-level courses, this was sort of one of the ways we'd seen some colleges set it up, that you've got a sort of a teaching area where you've perhaps got your anatomical models, your posters and your charts, and then perhaps you've got an area for developing other skills. So we'll come on to the hand hygiene trainers shortly. But probably one of the areas that's causing you the most headaches and the most concerns is the actual simulation ward itself, and how you get started with all the equipment that you need in there for teaching your students. So that is where we're going to start our tour.
Okay, so the first area we're going to look at is a responsive manikin. This was on the spec sheet from the Department of Health, and it was a phrase that, to be completely honest with you, never heard of before. The phrase responsive manikin isn't really something that we would normally use or say, but that's unfortunately where we are when things are written by people who haven't necessarily got the experience. But what we've kind of deduced from what they're asking for is that a responsive manikin will respond in some way to clinical interventions. So the changes that you make or the interventions that you introduce with your care, we can record that in some way. For example, a simulated patient monitor, or perhaps noises. So the mannequin of choice that we're promoting at the moment is Juno from CAE, one of our partners, and we work really closely with them, and they really help us to deliver the educational kind of the I don't know where I was going with that sentence. I said I knew what I was talking about, but I didn't there. So what's important about Juno is the 6 C's, which is the person-centered care. I'm going to set you another challenge in the chat. Who can come up with what the 6 C's are? I don't want to see any jokers putting in things that aren't included in here, because I only learned this today. But it's actually quite a good way to remember what the students need to do. But you can use Juno to simulate all sorts of scenarios, and you get things like breath sounds, heart sounds, bowel sounds. You've got a simulated patient monitor, which we'll come on to in a second, and it's interchangeable. So you've got male and female genitalia, different wigs, so you can have all different kind of simulated patients within one mannequin. So that's why we really like this one. But just to emphasize, this isn't the only mannequin that we offer, and we've sold lots of different ones to different T-level colleges because they might have different needs, and it's not a kind of exhaustive list. And we may well do another webinar where we focus on different set of products. But for this one, we kind of pitch Juno as the mannequin of choice.
And Juno is a particularly good mannequin for T-level health students. He is quite light to manoeuvre. So I know a big part of your course is patient handling and learning those manual handling techniques that are really important when dealing with real patients. You often, with mannequins, can find they're a bit cumbersome and they don't move as well. Juno's got various articulated joints so that you can get that sort of range of movement, the flexibility into the ankles, the elbows. But what's quite good as well is that he can be supported into a sitting upright position. So for students to be able to practice that range of movement and handling of a patient is really beneficial. And we're going to come on to now something that Juno comes with that you may find really beneficial as well. And this is some software that comes with Juno called Maestro, which Mark's going to have a little talk through with us.
So Maestro is a simulated patient monitor. So basically you've got one tablet, which, as you can see there, has the different parts of the body, the ECG, and different vital signs. And then on the wall, on the left-hand photo, you can see in the distance, there's a patient monitor, which sits next to the patient. So you can simulate pretty much any scenario that you can think of. You get 10 pre-programmed scenarios with it. And just to give you an example of some that we thought were quite useful for T-levels, you can task your students with assessing a hip replacement patient, which is obviously quite a common thing to see in hospitals. And also there's post-operative care of a patient with pneumonia. So that could be maybe a younger patient. But the kind of examples are absolutely are kind of endless. You whatever you can come up with. But we are certainly thinking of maybe designing some T-level specific scenarios. So it would be interesting to get your feedback on whether you think that would be useful, whether you'd use something like that, or if you just want to come up with your own scenarios. But this software can be used with the Juno Manikin. There's another Manikin called Aries, which is a slightly higher spec, which you can also use it with. But key to this is you could use it with a standardized patient. So when you're doing your ESP scenarios and your role play, you could have a kind of an actor sat in the bed or lying in the bed, and you could control their vital signs with the Maestro software. So that really gives a higher level of reality.
So we're going to move on now to what essentially is the foundations of a simulation suite. So they might not be the most exciting products. It's not a mannequin to get your hands on, but if you haven't got a bed, where is the mannequin going to go? And that's sometimes the question that we have to ask colleges and universities. They spend a lot of money on very expensive all singing or dancing mannequins, and they've got nowhere to put them. So to give students that real feel of what it's like to be in a healthcare setting, having hospital beds is essential. What you can see in the picture here, we have a set that comes together where you have the bed and you have the table beside it as well. We actually toured the factory a couple of weeks ago where they make these beds. Unbelievably, it's in this country. Well, we didn't think many things got made here anymore, but what that does mean is you've got really good quality beds at a price that's affordable for colleges, but quite fast turnaround times as well. So if you're needing to get your health suite set up and you want to get everything in before you get the rest of your equipment in, the beds can be provided quite quickly. We've also got simulated head walls. So if you have the compressor, it's a silent air compressor, and you can simulate oxygen and suction. The head walls not only give you the sort of that extra feel of reality of a real healthcare suite, but it's got things like call buttons on there. So for your students developing those critical thinking skills, when they're in role play, they might get to a point where they need to access more help, which would translate into real world experience. It's important to know when you sort of reach the limits of your own capabilities and you need to press the call button, you need to ask for help. And the final item that we have here is the emergency crash cart for simulation. So this is essentially a simulated crash cart that you can have beside the bed. But it has all the products that you would have in a real crash cart. So it helps with the students to manage the stock levels, but to really understand the importance of correct storage. They've all got all the equipment in these crash carts. Have got a place where they live for easy access in emergency situations. And so students can develop those skills of understanding why it's so important to have those items in the correct place.
Mm-hmm. So the next thing to think about is the sim screen. And this is something, it's a product unique to us. Nobody else has this. And it's really, really simple, but really, really clever. And what you can see on the left-hand side there is that they've created a simulation suite in just a normal office room, or it could be a classroom. So you really can, you don't have to have anything special. You can create a barrier between what's happening in the scenario and the person behind the glass there. It's a two-way mirror, so they can see through and they can see what's happening in the scenario, but the person performing the scenario, or the student, if they look up, all they're going to see is a mirror. So it helps to create a really good environment where they're not put off by you being there, and they can almost forget if they get immersed in the scenario that you're there. These come in all different shapes and sizes. There's the one that sits on the top of the desk there. There's full length ones. There's ones with corners, and there's ones with doors in. So you could actually create a fully mobile simulated room, control room, if you wanted to. It's a really good idea.
So it may be something that you wouldn't want to necessarily use during the ESP, but I know the ESP has been something that for teachers who've been through it last year, we know that the grades weren't what everybody wanted them to be, and there's obviously going through lots of reviews about that, and that's great that they're reviewing and seeing all the hard work that you've been in. But to to give students that sort of extra sense of realism, you could be using these screens prior to the ESP to practice those role play scenarios. We all know what it's like when we're training and we want to just look over and get that sort of face of reassurance. But when you're perhaps in real assessment scenarios, you can't really do that. You've got to think on your feet and be using the knowledge and skills that you've learned during the year. So that sort of just creates that extra barrier to stop students having to look to you for that extra reassurance. Right, so we're going to move on now to another part of our simulation suite. So moving away from the ward for extra pieces of equipment that would really help with different areas of the T-level curriculum. So we're going to come on to simulation suits first. I'm going to let Mark talk you through these.
So quite straightforward, really. These are empathy suits. So we've got a geriatric one. So you put all the different parts on and it straps up your joints and it puts extra weights in certain areas. And the idea is that it makes you kind of appreciate what it feels like to be an elderly person. They've also got a tinnitus simulator, which is the headphones. And you can simulate different eye conditions as well through the glasses. These have been incredibly popular. We keep selling out all the time, but we've ordered a big batch that are on their way now. So hopefully we'll have some pretty soon. The same with the pregnancy suit. Really self-explanatory, but it was designed for men, I think, to empathize with their pregnant wives, but people in education have been using them for a long time as well. A little bit of fun, we've actually had these featured on a couple of TV shows recently. The first one, I can't remember the name of, it was some trashy ITV reality show, but in a couple of weeks' time, this is going to be on Ant and Dec's Saturday Night Takeaway. We're not really sure what they're going to do with it, but they borrowed it from us last week to do some filming, and we're interested to see what happens. And then there's an obesity one as well. So yeah, these are really popular and a good bit of fun to have with the students. Really gets them engaged and puts them in the shoes of their patients. This is another couple of products that have been really popular recently. Simple concept that you put some special UV gel on your hands and you put them under the UV light and it shows up, it simulates germs basically. And then you go off and you wash your hands and then you come back and then you put them back under and you can see basically how bad you are at washing your hands or how good you are at washing your hands, which is obviously incredibly important in a healthcare setting. And then the new model that we had that we just started selling is the one on the right there with the camera. So rather than every student having to have a big box in front of them, you can have one or two at the front of the class. You can connect it up to a big screen, and then you can demonstrate, the best hand washing technique or the results afterwards on the big screen, so they don't have to kind of strain to see. So that's a really popular product. Quite straightforward, these ones as well. Pulse oximeters, which obviously measures your blood oxygen levels and your pulse rate. We have real automatic blood pressure monitors, real forehead thermometers, and then on the bottom there is a simulated blood pressure simulator. Depending on your students and the way that you teach, some people are more than happy to have the students doing the blood pressures and pulse oxes on each other. Sometimes it's you might always get a kind of normal reading if you do that, or a healthy student reading. Sometimes it's nice to have the blood pressure simulator because you can test them rather than telling you it's 120/80 every time. You can throw in a curveball and give them something unusual, and then you can really test whether they can actually take a blood pressure or not. So yeah, that's really good.
Right, so we're coming to sort of the last area. Perhaps if you've done teaching courses in health and social care, you're probably used to seeing these models. Obviously, with T-level health, you've got the core science element that goes into a lot more extra detail about the different parts of the body. So we can provide most parts that you would require. It sort of depends what you're wanting to focus on, really, and whether you are going along the healthcare T-level health route, or whether you're going down the health science route as well. But obviously, with children, with the students needing to understand lots of science concepts, including cells and tissues and exchange and transport mechanisms, we can have models that are kind of cross sections of those parts of the body, so students can see what they look like. The torso in the middle is probably our most popular anatomical model. It comes in from 8 up to 16 parts, so that you can take the parts out and really explore those different parts of the body. But in terms of the further science concepts that you're needing to explore and to teach, we've got models for the respiratory system, for the nervous system. So all the things that you're needing to teach, we can provide those models for you to teach with. So that sort of brings us to the end of our tour of our simulation suite. As we said at the beginning, this is just a very brief highlight of everything that we can offer. We know that there is such an exhaustive list. We didn't want to drown everybody in everything that you could have. But these are sort of the things that will help you to get started and help you to start to build up, or give you a good idea of the pieces of equipment that you're going to need. But what we do recommend is, because every college is different, some people have got huge spaces for the simulation suite. Some people have got a tiny classroom that they've been allowed to have access to, and they've got to try and fit as many things in as possible as they can. Is that we can do sort of one-to-one Zoom meetings like this with Marie, who is unfortunately not here today. But if she's been speaking to lots and lots of colleges and is incredibly knowledgeable about what's working and what's not working for colleges, and can give you some really great guidance for your specific needs. So you can email her there, marie@simmonsskills.com, or you can email us hello@simmonsskills.com with any questions, and we'll be more than happy to answer them for you. So if you've got any questions about anything that you've seen, I know not everybody always likes to pop a question in the chat, so emailing us is always the option as well. Then please feel free to drop it into the chat. I'm just going to stop sharing. Actually, no, I won't stop sharing screen, because I know that there's a question that Mark has prompted me to ask him, and that's how we can order. Because sometimes when people contact us and they've got lots of things that they want to order, they're not sure about how they go and order such multiple volumes of things, or they perhaps don't have a procurement department like big hospitals do, and so they want a bit of advice about how they go about ordering it. So Mark, that's your first question to answer.
Yes, what a good question. It's almost like I wrote it myself. Like Nicola said, we deal with lots of people from all different organizations, and we're totally we empathize really with, some of you, it's really small and you're really having to do everything yourselves, and some of you have got big organizations that you have to kind of navigate to be able to raise an order. So what we've tried to do is make it as simple as possible. So this picture you can see here is the Juno on the product page, and every product page next to the add to basket button is a get a quote button. If you click that button, what it will do, it will add the product that you've selected to a list. And then if it's just one product you want, then you can click through to give your details, or you can go to another product page and just click get a quote again. Keep clicking it as many times as you want, and it will create that list. And then it'll be a little pop-up that comes up that says view quote. Click on that, and then you can change the quantities. If you want more than one of something, you can do that. And then you pop in your details, click send, it emails us straight away, and then we can create a quote for you. And the reason that you need to have a quote is that when you go to your procurement department or your finance department, or whoever is in charge of placing the orders, they need to have something to reference to create a purchase order. They then send that purchase order to us, and then we create an order out of it. So that's basically how it works for absolutely everybody. So yeah, get a quote. If you're not sure, just contact us. We're very well practiced in doing this, and we can really help you to pick the right things. So yeah, if you need help, please just ask. There's plenty of us here. One other thing to mention, if there's anything that you need that we haven't got on our website, then please tell us. We're trying very hard to build the product portfolio as quickly as we can. We've got lots and lots of suppliers coming on all the time, and we've now we've got Steph in the background, and she works very hard to get all of the products up so that you can see them. But if there's something you need, we can probably get it, but it may just not be on the website yet. So yeah, please just let us know what you need, and we're trying to be a one-stop shop for you so that you don't have to deal with lots and lots of different suppliers.
Okay, so we've got one or two questions that I'm going to pose to Mark to answer for us. So one of the questions that we've had from a customer that was speaking to us the other day that some of you may be wondering about because we didn't feature it in here is whether we have any hoists for patient handling. Obviously, manual patient handling is quite a big part of the T-level course, and that's not something we've featured in the webinar, but is that something that we have available?
Yes. So that's a good example of one of the products that we have just added to the website, and we can now sell. So yeah, lots of things, lots of mobility aids, Zimmer frames, wheelchairs, walking sticks. These were things that weren't traditional healthcare simulation products, but it's something that we know that you guys need. So yeah, that's a good example of something that we didn't have, and somebody asked for it, and we got it. And again, we got it. Actually, it's the same manufacturer that makes the beds. Really, really good quality, made in this country. We can get them quickly. So yeah, a fantastic example.
Okay, let's ask you a slightly harder question then, as you've had too much of an easy ride. If you could pick one item then, perhaps from the webinar that we've just seen, that if it was got to come down to one thing that you need to have, what's going to really kickstart your T-level health course, what's it going to be?
We didn't rehearse this question. She just sprung it on me. I would have to go in terms of value for money and things that you can, the amount of things that you can simulate. It has to be the Juno Manikin, just because it comes with the Maestro software. You've then got the ability to use the standardized patient, but you can do all of your venipuncture or your airway management, everything, all these nursing skills and basic care stuff that you have to do as part of the curriculum. You can do it all with that Manikin, but also get a bed to put it on as well. So yeah, there isn't one thing.
Okay, that's great. Right. So as we said earlier on, if you need to get in contact with us at all about anything, please do. Our website is simmonsskills.co.uk. As we said before, we're trying to sort of be a bit of a one-stop shop. As being former teachers ourselves, we know that it's really difficult to be trying to search through loads and loads of different suppliers. So we're kind of everybody under one roof. And as Mark's just said, if there's items that we haven't got or it's not immediately evident on our website, then we can get those up for you. So please do get in contact. The other thing that we have available is that we have a product guide that lots of you probably have signed up for as well. But if you go to our T-level health page on our website, we have a product guide that has a lot of our recommendations of things matched to the curriculum. And as you've signed up for this webinar and have joined us, we are launching an updated product guide very, very soon, and that will be emailed straight to you. So you can register for the product guide now, get the current one, and then you'll get the updated one in a few weeks as well.
One more thing that's just popped into my mind. I briefly mentioned it earlier. So what something that we've been thinking about today, I mentioned how closely we work with CAE, who are one of the biggest simulation providers in the world, and lots of you will have heard of them because your local hospitals will use their equipment, and that's one of the main reasons why we work with them, because they're very, very good. But one of the things that's come up with us in regard to just T-levels is that many of you may not have done any kind of simulation before. You might not have written scenarios before. So one thing we were thinking of coming up with is perhaps writing a course, maybe a half a day or a day, where we could come in. Perhaps we could do it regionally to keep the cost down, but we would teach you how to run simulations, how to facilitate them, how to design scenarios, how to do debriefs. We might introduce video debriefing. There's lots and lots of options. So my question is, and just quickly put it in the chat, is would you be interested in a course like that? And by all means, if you've got extra things to ask or to say about that, or extra things that you'd like us to be able to teach you, then certainly lots of yeses with exclamation marks, which is good. So yeah, it's not the easiest thing to put together, but we can see that there is certainly a need, and we could do it. So yeah, thank you very much. That's kind of helping us to support what we've already been hearing from lots of customers. So we'll do our best. Yeah, stay tuned for that one.
As an aside to that, if you have registered for the product guide, or if you've registered for this webinar, and you must have done because you're here, you'll be on our email list. So any updates or information that we have for training courses or options to sign up for training courses, you'll be the first people to hear about that. So as we can see that people do want to have it, we will get that started for you as quickly as we can. As you can see, our colleague Steph has put a link to the T-Level product guide on the chat. So if you haven't signed up for it already, please feel free to head across there and sign up for that and have a good look through. But that's everything from us for this afternoon. Thank you so much for joining us, particularly for those people who tried to join us 2 weeks ago and we had a couple of technical problems. We really appreciate you taking the time to join us this afternoon, taking time out of your hectic teacher schedule, and we hope to see you on one of our webinars in the future. So thank you very much.
Thanks a lot. Take care.